Sports are the world's most important pastime. They're integral in every culture, essential to public health, and a great social activity. So, when someone experiences a physical injury, this can be extremely frustrating because they can no longer partake in this fun pastime. I faced this situation in 7th grade when I strained my hip flexor. It prevented me from running for my middle school track team for a period of time. This was a huge bummer because I loved the sport and had several friends on the team who I could no longer hang out with. However, I was intentional about researching how to recover as well as actively working on getting better. So, I was back on the track in no time. Because I've dealt with this injury before, I have a nuanced understanding of the recovery process. During this presentation, I'll walk you through how you must treat this injury with the Rice method, regularly stretch the injury, and rebuild strength in the injured area through light exercise over time. So, my goal with this presentation is to use my knowledge to help you recover from this injury in the most effective and timely way possible. Before we even discuss how to treat your hip flexor strain, you must first ensure that you have actually experienced this injury. Hip flexor strains are commonly caused by running, martial arts, cycling, or other activities that may cause overuse of the hip flexor muscles. By definition, a hip flexor strain involves a strain of any of the muscles in the groin musculature, pictured in the diagram. First, to determine if you have this injury, do a self-assessment. Do you feel pain where your thigh meets your hip? If so, you should then meet with a medical professional. They will ask you questions about your symptoms, family history, and activities, as well as examine your hip and thigh. They will inform you on whether you have a hip flexor strain or some other injury. Once you know that your injury is indeed a hip flexor strain, you should start the recovery process by utilizing the RICE method. RICE stands for Rest, Ice, Compress, Elevate. Make sure to rest your hip flexor. Don't start exercising it again right away. Then put ice in a bag and place it on your injury. This will help to reduce any swelling. Next, compress your hip flexor. This will also significantly decrease swelling. Make sure you wrap it tightly with ACE wrap, but not too tightly to restrict blood flow. Finally, make sure your hip flexor is elevated over your heart. This will decrease the amount of blood and other fluid that will fill the injured area. Once the swelling has been controlled, you should establish a routine to stretch every day. According to the Summit Medical Group, stretching every day will increase blood flow to the injured area and slowly increase your range of motion, both of which are necessary for recovery. One helpful stretch used for hip flexor strains is the lunge pictured on the slide, which involves lunging forward with a bent knee while keeping the other injured leg straight. With a little research, you can find tons of helpful hip flexor stretches online. As soon as you are comfortable with exercising, you should begin doing light activity every day that works your hip flexor. The most beneficial way to do this is through swimming. According to the North Central Surgical Hospital, swimming is the best way to recover from an injury for 3 main reasons. First, it is low impact, so it will cause little to no pain in the injured area. Secondly, it is non-weight bearing, so you're unlikely to re-injure your hip flexor. And finally, swimming is an active way to stretch, so while you're exercising, your muscles stay loose and flexible. The biggest mistake that people make in the recovery process from a hip flexor strain is pushing themselves too fast. According to Dr. John Rusin, an injury and rehabilitation expert, we are in the middle of a re-injury epidemic right now in America. This is because injured athletes simply don't know when to start going full force again. In order to avoid re-injury, you must first ask yourself, do I feel ready to jump back into my sport? If you do, then you must consult a doctor and have them assess whether you're ready to return or not. If you pass both of these tests, your recovery is complete. By utilizing the RICE method, regularly stretching your hip flexor, and lightly exercising the injury when you feel comfortable, you will effectively heal your injury and return to your sport in a timely manner. The road to recovery isn't an easy one, but remember, it's not about whether you get knocked down, it's about whether you get back up.